can come here in the front chairs, please, if you don't mind. No, I think on the stage it will be better. They can see. You can also go there.
In the back side, you should be in the front, my dear friend. You are not worn your regular tie and all. Why today you are in very normal position? Come in the front and sit here.
Krupa, Vishnu and Nikita, help everybody out, okay? Spread yourselves out, help.
Okay, start.
So, I just want to know one thing. Can you hear me, sir? Can you hear me? Yeah. Sir, how many of you all here work in front of the computer? Almost all? Okay, fine. Okay. So no, sir, because before giving an exercise, it's a habit for us that to know whom we are giving and what we are going to do. Okay. So if somebody is into the computer sitting for a long time, we ideally start them on first neck-based stretches. So now I'll just show you a few neck stretches. Make sure you sit straight like this and keep one side of the hand. Look straight, sir. Looking straight. Don't bend your neck first only. Keeping your hand here. Slowly try to bend towards one side. This will stretch your trapezius muscle here. Can you all repeat, sir? Do the same thing. ఇలా సైడ్ లో పెట్టుకోండి సార్, సైడ్ లో ఈ చెవుల పైన చేతి పెట్టి జస్ట్ bend towards one side. Okay, either side, sir, either side. Okay, repeat anyway other side. Yeah, repeat it on the other side as well. You also repeat on the other side. This is sideways, sir. You end up stretching your ikkada paina unna trapezius muscle.
How many times?
Sir, hold this position for 10 to 15 seconds. Okay, don't pull yourself too much, just pull yourself little bit so that you feel that stretch. Okay, sir, ये चेतो इकड़ इट्ला पाई नंच पेट्टुकोवाली मी आप ऐसे लगाना है सर, आप इस okay sir. Next thing is same neck stretch है కానీ you will rotate the neck towards one side, keep your hand above the head and then pull it down like this. ఇలా ముందుకి but side లో, so that yes madam, yeah, doing it right.
I'm getting sounds cut. Good no.
Sir, the athlete in you is waking up, sir.
Don't go cut.
Sir, next exercise is after working for about 1 hour or 2 hours, you keep your hands back behind like this. Whoever can do this, do it. Otherwise, I'll tell you other ways. Just keep your hand behind and do this movement. అంటే రెండు స్కాపులని ఇలా దగ్గర తీసుకురండి. So this will activate this particular muscle in the back. Okay. అయితే మీరు కంటిన్యూస్ గా చేయొచ్చు, లేకపోతే you can do repetition like this. ఎంత सर जितना है उतना करो सर. Sir, because if we sit for long time while driving your two-wheeler or four-wheeler or anything, you're sitting in front of computer, you end up sitting like this. So to counter that movement, you bring your spine back and activate the muscles in the back. Okay, that is the best way to do it. So the next exercise is so itla kaal meeda kaal eskondi sir, kaal eskoni back straight ga petti ila munduku vangali, but ila don't bend forward like this. Hip ee back straight undali, straight undi ila chesinappudu ikkadantha stretch avutundi. Okay,
Pull your chin forward.
Yeah, as if you are trying to touch something with your chin ila. Okay,
Push your chin forward.
okay, once get up, sit again. Sir, madam, chudandi, he's keeping his leg on the other side, but he is bending forward from this hip. ఈ స్పైన్ అంతా స్ట్రైట్ అయ్యాం చూడండి, అంతే. ఇక్కడ స్ట్రెచ్ అవుతుందా, ఈ హిప్ జాయింట్ స్ట్రెచ్, హిప్ మజిల్ స్ట్రెచ్ అవుతున్నాయా, అది. ఓకే, మళ్ళీ ఓకే, సిక్స్ టు సార్. అనదర్ బెస్ట్ థింగ్ టు హ్యావ్ లిటిల్ బిట్ ఆఫ్ రిలాక్సేషన్ ఇన్ ద స్పైన్ ఇస్ keep your hand on one side of the idi, left side, left hand, give me left hand. Hold it like this and rotate your spine towards one side. Yes, rotate it one side.
You also do.
She is gonna help all her colleagues do the same thing. सर अच्छा स्ट्रेच मिलेगा सर आपको, ठीक है बोल के नहीं, ठीक है ऑफ कोर्स 100%, बट जब आप करते हो ना, योर एंटायर मसल्स इन द स्पाइन विल गेट गुड अमाउंट ऑफ स्ट्रेच. सो इट्स अ सिंपल स्ट्रेच, सिटिंग लाइक दिस, holding your handle and then rotating your spine towards one side. Hold this position for 10 to 15 seconds and repeat it on the other side. Okay, that's nice. And okay. Now don't do this, first listen this. I want you all to listen and understand. Okay. So in this position, in this exercise, he is going to put his leg forward straight like this. Okay, now he will try to sit and then stretch his hamstring muscle. Okay, this is a very good stretch if you don't have knee problem. If you have knee problem, don't do this. If you have knee problem, because see, when he is trying to sit, there is some load in this, but this is a very good stretch for this muscle. Okavela, if you are not able to do this, simple thing is stand down, put your leg on the stairs and just do this, that's all. Very good stretch. Or now you can try, stand, put your leg forward like this, put your leg forward and slightly bend forward like this, ante. स्ट्रेच मिल रहा है यहाँ पे, हाँ, दिस इज हैमस्ट्रिंग स्ट्रेच. और सर, और वन मोर थिंग आई विल टेल यू, sir, or one more thing I'll tell you, you can also put leg on something like this, that is also very good stretch. Just put your leg on something like this and do this, it is very very good stretch, simple stretch. Sir, knee bend చేయండి. Okay, sir, one minute. Imagine you're in this position, you're trying to sit in a chair. Okay, now what you'll do, you'll bend your knee, right? అలా బెండ్ చేసి మీరు ఇలా ఫార్వర్డ్ బెండ్ చేయండి సార్. You can see your hamstring stretch. Sir, sit like, you all can sit like this. Sir, you all can sit like this. Okay, hug your knees as much as you can. Hug your knees as much as you can. Sir, वो तो stretch है, अगला exercise है, just do this movement, that is also good for your hip joint. Sir, जितना आएगा उतना करो ना sir.
Back straight. They don't lean straight. Be straight.
So just the movement sir, that's all.
मुझे तो यहाँ जाना पड़ेगा सेंटर में, जाना पड़ेगा इसको लाठी मार के बैठा, योगा करने के लिए लाठी मार के बैठता है. Now next.
Yeah, the other leg.
सर गोल है सेंटर को ना आने को.
Sir, everybody has stairs in their house. Okay, so hold something like this, keep your leg outside and then drop your heel like this. It will stretch your calf. Good stretch again, but take some support and do it. Don't do it just like that.
Otherwise you will fall.
Yes sir. So take support.
If you fall straight, then you broken.
Sir, if you all can see me. Sir, people sitting in the back, if you can see me, just like this.
Not on the top step. First step. You don't fall down.
This way. It will stretch your calf. Okay. And
Any stretches for the brain?
Spine is good, brain is good. Brain is good, spine is good. Yeah.
Sir, the one exercise which I told, illa ever cheyalekapotaro, vallu they can go to the wall, keep hands like this, just do this. नहीं सर वैसा नहीं वही बोल रहा हूँ. दीवार के पास जाना है,
दीवार के पास गए,
हाथ लगाओ, बस पीछे करना है. हाँ, ज्यादा आगे नहीं आना है सर, यही से बस इतना ही.
Don't shake your neck. No, you're shaking your neck. Neck is straight. Just the shoulder. Neck straight.
how we can compete? You are a yoga teacher.
It will activate this part, sir, this part of the muscles. Yeah. And sir, lean on the wall. You can do this also. Lean on the wall and do it. Not just like this. Lean on the wall. Because your spine should be stable and do this. Okay. I think this is enough, sir. Within whatever small resources we have.
Thank you, Dr. Suman and the team for detailed information about spine postures and yoga exercises. Ladies and gentlemen, please give a big round of applause to them. Now we will start the open house session. I invite Mr. Shekhar Agarwal, past President, Chair of Healthcare Committee, to chair the open house session.
We'll have a very
Over to you,
quick one. Any of your questions or queries, just you can raise your hands. Otherwise, we had a wonderful session, sir. Naresh sir, Suman sir, Dr. Suman, we had a wonderful session. The theory and Sudha madam, wonderful session. And practical exercises also, all of us we enjoyed. And looking for advanced session from our seniors sometime later on. Okay. Now, anything you like to ask, or we go ahead? Thank you very much. So,
Please.
okay. So, there one question: what type of mattresses we should use? Should we have the cotton mattresses earlier days, or sponge mattress, or anything like?
Sir, ideally the mattress should be firm. It should not be like the one which is there in 5-star hotels, where it is too soft. When you sleep, your spine position goes, instead of it being like this, it will go down like this, which will cause a problem. I get to hear a lot of people complaining after a travel, they'll get this pain. So ideal thing is the mattress which has got foam inside it, which is very firm, not soft. And definitely spring should be avoided. A lot of people have spring mattress as well. Please avoid spring mattresses. Use something which has foam. Okay?
High density foam?
Yeah, high density foam. Even when we were young, that cotton mattress which is stitched properly, tight one is good. But then it slowly goes in like this. It is ideal to flip the mattress or change the head end to leg end and leg end to head end once in every 3 months. I think that will do.
One question, sir. Since this was back of my mind, since we are at FTCCI, if there are any mattresses manufacturer in Telangana, we would like to work and create more awareness, sir, because sleep and sleep positioning is becoming a bigger problem now. Because we have got altered so much.
Century mattresses.
Yeah. Because we are partnering with one organization in Australia where they are working with mattress companies, sir. Because we are looking at root causes. We are not looking at treatments. Suresh ji, treatments ke liye nahi hai. How we can fix it, which we by default we do it.
Shivroomka ji.
How long it takes for assessment at your facility?
Sir, half an hour, sir. Half an hour. Half an hour to 40 minutes.
You screen entire body?
Yes. Full. From head to the toe. Yes, sir.
Ankit, you want to?
Yes, sir. I have a couple of basic questions, sir. Like those who have sciatica problem, people often they do get, say, advice that you should go for operation. But some of them, most of them, they go for Kerala massage therapy. How effective that is? That is my first question.
Sir, basically, first, any spine problem, I'll tell you the truth. I mean, I think Naresh sir also mentioned that in the beginning. Out of 10 patients, 8 of them can be treated without any surgery. The last 2 or the 3 patients will go for surgery. It's a norm. Okay? And when you're coming to your question, sciatica, it depends on how the patient presents to us. Somebody will say, I have only pain in the back. Somebody will say pain is there throughout all the legs. So when there is pain in the legs, it means the disc is come out and it is compressing the nerve. At that time we end up seeing the MRI and see how much, we call it as stenosis, how much it is there. If it is minimal and if it is at the initial stage, we probably advise them first initially rest and take medication so that the pain comes down. Once the pain comes down, what should be done so that the nerve compression doesn't happen, and if there is any muscle spasm, we give exercise for the muscle also. In the first place, why does that disc come out is because I told you again, the sitting position, if it is like this, then the vertebra gets opened up like this, so disc comes out. So we end up giving you exercises in which the vertebra gets closed like this. Closed in the sense doesn't close, but will not allow the disc to come out further, like that. And exercises will be prescribed for. Sir, sorry, sir.
Can we cure sciatica pain?
Absolutely, yes, sir. Again, depends, sir. If the compression is too much that it is causing extreme level of pain, immediately we'll say no, this stenosis is too much. It is closing that space through which the nerve has to pass. If that space is completely closed like this, then the surgery is a option. But if the space is this much and the nerve is freely moving, there is some amount of compression that can be cured, sir, not a problem.
This is second.
Sorry, sir. Varicose. Sir, varicose is completely different. Varicose is usually what happens is your blood vessels, which are veins. What happens in general, normally what happens, that pure blood from the heart goes into the limbs, and then impure blood comes back into the heart, goes to the lung, and then gets corrected, and again flow happens like that. So because of weak leg muscles or weak leg muscles activity, what happens, people who stand for a long time, that return flow, which is called as venous return, does not happen. Okay, and then the blood kind of gets the lymph, basically it kind of gets accumulated in the lower side only. That's when the vein slowly starts bulging it up. Yeah, that is called varicose. But varicose doesn't cause any pain as such, sir. Very rarely it causes pain.
The second point was.
Just to add to your question, see, I always use this common analogy. When there is stone fallen on your leg, okay, sciatica is a nerve, the name of the nerve. Okay, when the disc comes out, the disc is sitting on the nerve. It's like a stone falling on your leg. Would you remove the stone, or would you see that the stone will melt? So removing the stone is a surgery. If the stone size is smaller, right, you'll allow it to slowly dissolve. It's not hard. So any foreign material that comes and touches your nerve, because nerves are the one which directly connected to your brain. So it decides your intensity of the pain. So yeah, and it also decides your pain tolerance. Okay? At least 20 years back, our generation, they had maximum pain tolerance. Okay, that's why they used to sleep on a flat bed. They get a massage. See, the massage is you're rubbing, so that some of the pain signals are getting numbed to the brain, so that you're not feeling pain. But actually, your underlying cause remains like that. Okay.
To say that the naturopathy doesn't give that much, say, the final solution for your problem.
There are people who says that this came out. Okay, they have been doing pain relief. Okay, if you tolerate the pain enough and survive, the body itself do the course correction. So that's why I said, वो मेरे को सर्जरी बोले थे, मगर मैं सर्जरी का करना मन था, पर 6 महीने वो पेन कोई भी नहीं बोलते बाहर. But some people says that very clearly, borderline. Okay, the stone is small, so the decision of the person is very important. Yeah, absolutely it works, depending on which stone is on your. If it's
So,
smaller, it works.
So one more thing, sir. Sciatic nerve, it has got its own course. So when we are sitting and there is one muscle under the muscle which this nerve goes, that's called piriformis muscle. If that muscle is also very tight and it is compressing the nerve, it gives a similar symptoms like sciatica. So when people come to us, we'll also check that particular muscle. What you're talking about massage is, ऊपर से जो massage करते हैं ना, that I don't know that how much relief people get, but if you are pointing your trigger release to particular muscle, then probably you can get that relief what you're talking about. But as such, general massage will not cause any relief and all that. But if you are focused on that particular muscle and release that muscle, that's why I was telling you, we do manual release and we also do dry needling. Dry needling is directly going into the muscle and puncturing the trigger which is there. Then person will feel a lot of relief.
So some of the RO or say water purification companies, specifically Japanese company, they promise that if you consume that kind of alkaline water, it gives you relief whenever you have problem with sciatica or similar things. So does it have any catalytic, kind of ions working and relaxing your muscle or nerves? Is there any scientific evidences of doing it? Because they all get sailed out.
You are talking of Kenyan water, it doesn't work.
No, sir, it doesn't. I mean, to be frank, if you are having healthy water, I think it is good for your body, but I mean, it will keep your body hydrated, but no, nothing like that. That material will not cause anything, no, nothing like that. No, sir,
Thank
it
you,
doesn't
sir.
help, sir. Ma'am, that's a good question, madam. Actually, just now, till now, we were trying to show a lot of stretches. So, ideally, these stretches, you can do it in 5 to 7 minutes. So, if you have a break after 2 hours, once in every 2 hours, if you have real stiffness and you are struggling, probably do it once in every 2 hours. Or else, you can do it once in the morning, once in the evening. That is also fine. Depending upon your if you have a lot of stiffness, if you feel very tight and you want to feel stretching for a little bit more time, you can do it once in every 2 hours also. Nothing wrong, no wrong in that. But as such, as a habit, you can do it maybe once in the morning, once in the evening. That's fine. Sir.
Regarding pillow, you like to tell what are we?
Sir, I was telling about the pillow while I was talking also. Pillows sometimes put, a lot of people put bigger pillows.
Sir, pillow, suniye. Yeah, please. Please go ahead.
Yeah. So if you put a bigger pillow, then you end up sleeping like this, which will cause too much load on your neck muscles. If you are sleeping in the sideways position, your point of collision in the bed is your shoulder. So the distance between the shoulder till the ear has to be covered with the pillow. So if you are sleeping sideways, you can use a slightly bigger pillow because this space is much bigger. If you are lying down straight, probably a smaller pillow will also do.
Okay. Anything else, doctor, you like to add? Thank you very much. Over to Vishala.